here's your arm, right? This is actually the arm hanging down. Here's the shoulder girdle that's attaching the arm to the chest. Okay, so if I ask you on the test on the 16th, what's the function of a girdle? The girdle attaches the limb or the extremity to the trunk. That's what it does. No girdle, no attachment. It ain't gonna happen. Not gonna happen, right? So the shoulder girdle is the first one we're gonna look at. It consists of two bones. One is our collarbone called the clavicle. The other one is the wing bone called, anybody know? Scapula, very good, the scapula. So the clavicle and the scapula, they make up the shoulder girdle. The job of the girdle, again, is what? To attach
the extremities of the trunk.
To the trunk. To the trunk, perfect, right? To attach the extremity to the trunk. So guys, this is what the clavicle looks like. If you can just kind of take this out, we're going to kind of we have to share them, we only have one per table. But watch this. It's a little bit of an S-shaped bone. It has two ends to it. If you notice, one end is flat, one end is round. So here's how we're going to sit it. Which one we got here? I got left, I got the right one here. So the flat end goes out over here to the shoulder. The round end goes to, what's the top part of the sternum called from last week? Anybody remember? Begins with an M.
The mandible.
Not mandible.
Mandible.
Manubrium, right? The manubrium. And remember we saw there was two clavicular notches? So we actually were palpating when we kind of went like this. So the round end is the sternal end. The flat end, what do we call this region of the shoulder up here, the high point of the shoulder? Acromial. So guess what we call this end? The acromial end. Right? So you need to know how it sits in the body. The flat end out here, the round end medially. Okay? The bottom part of the clavicle, so this is the flat end over here. You can see it's flat. This will be the acromial end. Here's the sternal end. The underside of the clavicle, if we look at the bottom, has two bumps. You'll see kind of a big bump on the lateral end. This bump going down right here is the conoid tubercle. So again, it's a little bit hard to see on this picture, but there's a bump coming down. You'll see it better on your actual clavicle if you're holding the clavicle. This bump, you can actually see it pretty well on this bone. That's the conoid tubercle. Then on the sternal end, it's not so much of a prominent bump. It's more of a roughness. That roughness is the costal tuberosity. So that right here, it's a little bit rough. So both of these are on the underside. What they do is this. There are ligaments that come up and attach to those two bumps, and they hold the clavicle down so the clavicle doesn't pop away from your chest. Okay? So those ligaments hold the clavicle down, and they attach to the bumps. Again, the lateral bump, conoid tubercle. The medial bump, costal tuberosity. Costal tuberosity. That's it. 4 things you need to know for the clavicle. Sternal end, acromial end, and then the two bumps on the bottom. Conoid tubercle, conoid tuberosity, and the conoid tubercle and the costal tuberosity. Right? Those are the things you need to know at the underside. Questions or comments? Okay. The second bone that makes up the shoulder girdle is this big triangular bone. Okay, this one is the scapula. So watch this, guys. If you're holding the scapula like this, the whole thing, you can see it's a triangle, right? Kind of like that and this. What do we, from geometry, we did this with the sacrum too, and the coccyx. What's the flat part of a triangle called? The base. So notice this top part here is the base. What's the pointy part of a triangle called? The apex. Very good. The apex would be down over here. So the base of our triangle is the top part like this. This actually sits on our body. Stand up for me a second. Just face this way. This sits on our body this way. This smooth end goes right up on your chest like that. So the base is superior, the apex faces downward like that. So this is how it sits. Thank you. So the base is here, the apex The body of the triangle, or the body of the scapula, is everything where my fingers are touching. All this, all this. It's no specific structures, it's just the main part of the scapula, okay? So you should know that the base sits superior, up, the apex points down, right? Just like the sacrum did, the base was up, the apex was down. The coccyx, same thing, the base was up, the apex was facing downward. So now that we kind of have the orientation, like I said, the way it sits on the chest, let's take a look at the landmarks. So I just listed them up there for me so I could follow the way you guys have your notes, so I'll jump around. Watch this. There is a little depression on the side of the scapula where our arm bone, the humerus, is going to sit. We'll see that in a couple of minutes. This area here, all around that depression, this whole thing, this is the neck of the scapula. So this whole entire, I guess almost like a collar that goes around here, this is going to be the neck of the scap, right? The neck. Now, we're going to see that the scapula has 3 borders, and then those 3 borders come together to make 3 angles. Okay, so we have 3 borders and 3 angles. The border, let's see, we put this on me for a second. The border here, so I can do this, the border here, that's closer to the, you know what, let me borrow you for a second, it's taller. Facing this way. The border that is, here's his spine, the border closer to the spine, right over here, is called the vertebral border, or you can say medial, because it's closer to the midline. This border over here that's going to the armpit area, what's the word for armpit? Axillary, right? We could call the axillary border. Notice it kind of runs at an angle. So this long border here, closer to the spine, very easy, vertebral. The one that goes at an angle over to the axilla, axillary. Okay? Thank you. Okay? If you feel the vertebral border, you can see it's kind of like it's got a thin, long edge to it. The axillary border is a little bit of a thicker ridge, bigger muscles attached to it, so it's got a thicker ridge.
Can we say lateral border?
Either or, whatever you like, I'm good with. Okay, so medial and lateral, or you can say vertebral, axillary, whatever you like, guys. Now, there's one border right on the top where the base is. This border right here, guys, this line is the superior border. So that one right there would be the superior border. Okay, so 3 borders. Now these, oh, just one other thing. In the superior border, you see this little notch? Again, I'm not sure if you guys can see it in the back. You'd have to look at your own. There's a little indentation going down in the superior border right here. This border, or this notch I should say, is the scapular notch, or some people call it suprascapular notch. Either or would be okay. What do I have in your notes? Scapular notch, that's fine. Suprascapular would be okay too. There's some discrepancy there, okay? So this border right here where my finger is kind of lying on, this is the superior border. The border closer to the spine would be what? Medial or vertebral, right? Medial or vertebral. The one that is closer to the armpit would be lateral or axillary, okay? So those are the 3 borders. Now, the 3 borders meet to form angles. What do I have first? Let's take a look at the superior angle first. Very easy. Where the medial border here meets the superior border here. See this bump right there, that point?
Mm-hmm.
That is the superior angle, right? So the medial border comes up, it meets the superior border right there. Superior angle. Can't miss it. Where the lateral border here meets the vertebral border at the bottom, right there, inferior angle. If you go like this, just kind of take your hand, put it behind your back, see how your shoulder blade sticks out? That point right there where my thumb is, that's the inferior angle. So it kind of sticks out when you put your hand on your back. So the inferior angle is kind of located in the region of the apex. On a test, if I ask you what's the specific structure, the answer I would prefer is inferior angle. The region of it is really the apex, but the actual structure is the inferior angle. I probably wouldn't mark you wrong if you said apex, but in clinical medicine, if you're working in, in a hospital or something like that, we usually say the inferior angle. Okay? So, one more time. What angle is up on top? Superior angle.
Inferior angle.
Inferior angle. The last angle, I didn't even know until I started teaching here. It was something I was never taught. It's called the lateral angle. So if we go back to this little depression over here, which we're going to talk about in a minute, this little angle right here, guys, where it goes from this to the lateral border right there, this is called the glenoid cavity, to the lateral border, that angle right there is the lateral angle. Lateral angle. Okay? So you need to know 3 borders, and they form 3 angles. It's that easy. Okay? Anybody, questions or comments? 3 borders form 3 angles. Okay. So, if you haven't kind of figured it out already, how do you tell the front of the scapula from the back? Just like the sacrum. Remember the front of the sacrum was smooth and the back was all lumpy bumpy? Same thing here. The front of the scapula is smooth. When you look at the back of the scapula, it's got this prominent bone here. It's kind of got, just more going on to it. So this would show you're looking at a posterior view. That's what we want to look at now, this way, okay? So check this out. I'm going to go a little bit out of order for a second from your notes. This big ridge of bone right here is called the spine of the scapula, or the scapular spine, however you want to say it. So watch this. Take your hand, go over your shoulder like this, and just kind of palpate up and down. You're going to feel, I feel like this ridge of bone right here, it's kind of like a sharp edge. What you're feeling is this bone right over here, right? It's a big bone, it goes all the way up to your shoulder, okay? So this is the scapular spine, or the spine of the scapula, however you want to term it. The beginning of the scapular spine, right here at the medial border, is what we call the root. So what they mean by that, I think, is the beginning of the scapular spine. Where does it begin, right? Like the root is the beginning of a plant type of thing. So here would be the root. If I asked you on that test in a couple of weeks, what is this structure here? You're going to say scapular spine, or spine of the scapula, whatever you like. I'm good with both. And then finally, guys, this part here that ends up at the top of the shoulder over here, again, what is this region called? Acromion. Guess what we're going to call this piece over here? The acromion process. All right, process. That's fine. Acromion process. What was the flat end of the clavicle before? What do we call that? The flat end of the clavicle was the what end? Say it. I heard it over there. Acromial end. Thank you. So watch this. The flat end of the acromial end of the scapula articulates with the flat surface of the acromion process. The acromion goes to the acromion. Okay? The acromion of the scapula. Damn. What is this bone? Clavicle. Acromion of the clavicle goes to the acromion of the scapula, right? They're always going to go together. And they're right here. If you take your clavicle, feel it up to the shoulder, and then you'll feel it meet the scapula and move around a little bit. You can actually feel a little bit of movement in there, right? Those of you going into physical therapy, orthopedics, that joint we call the AC joint. So sometimes the 2 bones come apart. That's what we call a separated shoulder. Do you ever hear that somebody has like a separated shoulder? Not dislocated, but a separated shoulder. The clavicle comes away like that. Okay? It could be total, or it could be just a partial type of thing. So those of you, again, going into orthopedics, it's a condition you see a lot. We're just going to pass this around again. I saw a couple people come in late, so just kind of pass it through, make sure everybody gets it. Okay? All right, so guys, there's 3 parts to this back part here. The part where it begins, what are you going to call this? Before the spine. Where does it begin, though? The root. This part is the spine, and then the terminal end, the flat end, acromion process. All right, even if you said acromion, that's acceptable too. Acromion process, or just the acromion, nobody would argue with you. Nobody would argue with you. Okay? So the root, the spine, the acromion. Okay, so I kind of talked about this thing a couple times, this area here where the neck was and the lateral angle. So let's give this thing a name now. This is the glenoid cavity, or you can say glenoid fossa. Glenoid cavity or glenoid fossa. What's going to go there? So this bone here is our arm bone, the humerus. Watch this. The arm bone is going to sit right up against the glenoid cavity like that. You can see it's not a deep cup, right? It's not that it's sitting in the cup. It's actually a very shallow cup. That's good because it allows this. It allows us to move our shoulder all the way up. We can move your shoulder all the way forward, right? We can move it back pretty far. I can rotate it. So that's good. The bad thing is, since it's not a deep cup, it's an unstable joint. And a lot of times this will happen. Somebody will fall. They put their hand out to brace their fall. I actually call that a fush injury, a fall on an outstretched hand. We say F-O-O-S-H, just as an abbreviation. Say somebody falls off their bike. I'll tell you a story. Last winter when we had all the snow, I had gone over to the Chase Bank over by Eisenhower Park on Route 24 there, just to get away from school for a little bit. And it was icy out, and I saw a lady walking, an elderly lady, and she slipped on the ice, and she did a classic thing. She put her arm not out like this, she put it straight out like this, and she fell on her hand like that. So I ran over to see if she was okay, and she was in a lot of pain. When I took her coat back a little bit, her shoulder, her humerus, wasn't in the socket, it was down here. Wait, which one was this? She fell with her right, but I'll show you on the left. This happens to be a left one. I didn't see this part of her shoulder here. Her arm bone was here. All right, so it actually popped out of the socket and it came down quite a bit. So this is a dislocation. The other one, where these two come apart, is a separated shoulder. And I won't ask you that on a test. It's just kind of interesting that you hear, separated shoulder is where the clavicle comes away. Dislocation is this. This is a common injury. A lot of times in sports, who's a wrestler? You're a wrestler, right? You guys, you've seen him before in wrestling? In wrestling, I've seen it a lot of times where the arm comes back, and you bring the arm back like this, and it just pops forward and boom, right out of the arm. So it's a common injury, but the reason is, look how shallow that joint is. Right? We'll see in a little while our hip joint where the femur bone goes. That cup is a lot deeper. It's very hard to dislocate your hip. If you dislocated your hip, you will probably hit by something very hard, like a truck or something like that. It's just not going to happen. It's just not going to happen that easy. Okay. Two other things, guys. On the front of the scapula, there's one projection that sticks forward. It kind of reminds me of a bent finger. Every time I look at it, I kind of see this bent finger kind of thing. So this bent finger right here, facing forward, this is called the coracoid process. Coracoid process. We're going to see some important muscles, like you guys have heard of the bicep muscle, right? Bicep muscle attaches to this in the front. One of your pec muscles, the chest muscles, attaches to this over here. So it's a forward structure. So do this for a second. Go to where your clavicle bends in, where it's concave, right there. Go down about an inch, push in posterior, and then lateral a little bit. Like mine's a little bit sore. I did a little bit of raking yesterday, and you use your bicep when you're, it's pretty sore. So if you worked out, if you did like that type of thing, a chest type of workout, using your arms a lot, right here is the coracoid process. So again, this sticks out anterior. The spine is posterior, okay? So it's important, otherwise you're gonna get confused. Posterior structure, this is anterior structure, okay? The last things I wanna show you are three fossas that are associated with the scapula. Check this out. So what was the structure again one more time? The scapular spine. Good. So watch this. There is a fossa, which is a shallow depression above the scapular spine called the supraspinous fossa. What does supra mean? You think? Above, superior, right? Perfect. Spinous means the spine. So it's telling you where the fossa is. It's a fossa above the spine of the scapula. This right here is the supraspinous fossa. So here's the deal. If you understand the bone markings well, you will find muscles extremely easy when we get to that. Because the supraspinous fossa houses one of the rotator cuff muscles called the supraspinatus, right? Supraspinatus. So the name of the fossa that the muscle sits in is the same. Supraspinous fossa houses the supraspinatus muscle. Right? So again, if you understand the bone markings well, the muscles are going to be a joke, a total joke. Okay? What do you think? Below the spine of the scapula, what fossa would this be here? Infraspinous fossa. Guess what the name of the muscle that sits in there? It's a rotator cuff. Infraspinatus. Okay? So when I show you these muscles, I'll remind you the names of the fossas also. Okay? So one fossa above the spine of the scapula, here. One fossa below. Look at this big fossa right here, this big depression right there. That is the infraspinous fossa. The last fossa is here. If you look at the underside of the scap, this whole shallow depression in here is the subscapular fossa. What does sub mean?
Low.
Below, like a submarine, right? Goes what? Below the surface of the water. So this would be on the underside of the scapula. Guess what? There's a muscle in there called subscapularis, right? Sits in the subscapular fossa. So just off of that, we know, just from the names of the fossas, we know 3 rotator cuff muscles, kind of just by their names already. Okay? I love this bone. I love it so much, it's probably 2 stations on your test. So I would suggest you love it as much as me, because there's a lot of questions on it, right? Touch it, feel it, kiss it, make a connection to it. Looking at the picture ain't gonna do it, I promise you. I'm telling you, I'm giving you 2 weeks warning to get to know this bone, and you're just gonna bang through this test like you won't believe. Hand up, someone question?
Me.
Yeah.
The coracoid process. What is
Yeah.
located?
So when you look at the front of the scapula, the anterior surface, that's the thing that kind of has that bent finger look. That's it right there.
Oh, okay.
So it kind of sticks out here in the front over here.
Okay.
Anybody else? Okay, so clavicle and scapula, again, they make up the shoulder girdle. What's the function of a girdle?
Extremities to the.
Attach the extremity to the trunk. That's another question, I guarantee. I bet my house, my wife, my kids, my dog who I love, I bet you I will ask you that. Okay? So if you don't know it, I can't tell you anymore. You gotta know it. People just don't know it when I ask them. All right? Let's go to the next bone. Oh, just real quick. Oh no, we did all this, okay. This is a front view or a back view? Back view, right? Remember lumpy bumpy, man, big thing on here. You see this thing right here? This is a back view. This is your front view. See how it's all smooth right here? There's nothing there. That's all front view, anterior. Okay. So guys, take out, you know what? Take out 3 more bones. Take this one out here.
Oh boy, look at this, man.
Not that one. That one right there, the one in your left hand. And then take out a bone that looks like this. It's got like a little U shape over here, like this. Yeah, the one in your right hand you can leave out. This one right here, it's got like a little U shape. Hold on, I think you knew that already. Very good. And then this one here, that's got like a little round, looks like almost like a lifesaver, like a Certs type of thing up over here. Take those 3 bones out. Okay. So these are your two forearm bones. This is your arm bone, right? The